Welcome to our channel. Today we're going to talk about vitamin D3, also known as the sunshine vitamin, because your body can make it when your skin is exposed to sunlight. Vitamin D3 is essential for calcium absorption, which is crucial for strong bones and teeth. But it also plays an important role in supporting the immune system, brain health, and muscle function. Why is vitamin D3 important? Without enough vitamin D3, your body can't absorb calcium effectively, which may lead to weak bones, fractures, or a condition called osteoporosis in adults and rickets in children. Low vitamin D3 levels have also been linked to a higher risk of infections, mood disorders, and fatigue. Sources of vitamin D3: sunlight exposure, 10-30 minutes a few times a week. Fatty fish like salmon, tuna, and mackerel, egg yolks, fortified dairy and plant-based milk, dietary supplements. Benefits of vitamin D3: strengthens bones and teeth, supports immune system health, improves muscle strength and function, may improve mood and reduce depression risk, helps regulate calcium and phosphorus levels in the body. Recommended dosage: the dosage depends on your age, health, and vitamin D blood levels. For most adults, the recommended daily amount is 600-800 IU, but some people may require more if they are deficient. Always consult your doctor before starting supplements. Possible side effects of too much vitamin D3: taking excessive amounts can cause nausea and vomiting, weakness, kidney problems, high calcium levels in the blood, hypercalcemia. Precautions: always follow your doctor's recommended dose. People with kidney problems or certain heart conditions should be extra cautious. If you take other supplements or medicines, ask your doctor about possible interactions. Final thoughts: vitamin D3 is vital for overall health, but balance is key. A healthy diet, safe sun exposure, and supplements, if needed, can help you maintain the right levels. Thanks for watching. Please like, share, and subscribe for more health education videos.